Hi friends, Joanne from Aberdeen Home Care. Today we are going to be talking about gloves and hand protection and whether that's a good thing or a bad thing and how you are to manage your gloves. So these are nitrile gloves. They are non-latex because latex gloves are actually being phased out because so many people have a dermatological reaction to those. So these are nitrile gloves. These are what's readily available in all your CVS and Rite Aid and Walgreens, as well as online. So I'm putting on a pair of gloves. These are not sterile gloves. When you see a hand like this, it reminds you of being in the doctor's office or in the hospital or having a procedure at the dentist office. And when you see these gloves, in your mind, there's a message that says, oh, those are clean. Those are being worn for my protection. And that's true in the medical community. They're doing two things. They're protecting the wearer and the patient. In this situation, in COVID-19, they are actually protecting the wearer only, and I will show you why. So I have the gloves on. I am not a practicing clinician at this point in time during the virus. So otherwise, I would have bracelets off. These bracelets, I have no rings on my fingers because that traps bacteria and virus. I would take all the jewelry off because that's obviously an opportunity for contamination. So excuse that, don't look at that, just look at my pretty blue fingers. So I have my gloves on and the message my brain is getting is, oh, my hands are clean. Yes, my skin is clean under these gloves. So I'm going to the grocery store. Watch what happens. I'm going to pick up some honey off of the counter, and I'm looking at that and I'm deciding that I want that, and I'm putting that in my cart. Well, what happened as I did that was somebody else was just in the store before I was and had touched this with their hands, which were dirty. Do you see that peanut butter? That's dirty. So they looked at that same honey that I looked at and they touched it with either a dirty glove or their hand. And guess what happened? Take a look at this. Do you see all the opportunities for virus that are on the honey? Okay, so the next thing I'm going to grab off the shelf is this container of tea. And again, I'm going to look at it and I might put it in my wagon and I might put it back, but look what it has on it now. Now my hands are clean, but my glove is not. My glove has touched contaminated surfaces. And so on with my breadcrumbs and my wheat thins and my milk. When I touch something that has been touched by others, you see the contamination that exists from someone else's dirty hand or glove. So now how do I process this? Well, I'm going to take all of that home and I'm going to wash it and sterilize it because I don't know who else's dirty gloves or dirty hands have been on those particular products. The same is true whether you are going to the gas pump or whether you are going to the ATM machine or wherever you are in public, whatever your hands are coming in contact with. Your skin is clean. So there's a message that's going to your brain, oh, it's on the glove, it's on the glove. It's on the glove until you pick up your car keys or you touch your steering wheel, or after you pump your gas, you use the same dirty glove to get in your car and touch your steering wheel. How about your payment? How are you going to manage the payment? Well, I'm going to suggest that you do this. You're going to take the outside of the glove, which is the dirty part of the glove, pull it out, and take that glove off inside out. Now what you have is you have a clean hand that's been inside the glove, and you have the dirty side. So if you have your ATM card in your pocket, you can take that out and you can put that with a clean hand inside at the grocery or swipe it at the gas pump. And you have a dirty hand. It won't really have peanut butter on it. And you can continue to use your other hand to put in your numbers and do your transaction. Take your card out. I actually have a baggie for my card. So I put the card in a baggie and stick it back in my pocket. Then, what are you going to do with your other glove? You're going to just pull it off to the side, and you're going to pull it out. These are very stretchy now, and you're going to pull it in inside out, and there, what do you have? Both gloves, and the dirty stuff is inside. This is clean. This was against my skin. So this is what we have now, a completely clean sack of my gloves, which can be tied up in a knot if you're familiar with doing that. I keep a baggie, Ziploc bag in my car. And after I use a dirty pair of gloves, I open it up and throw it in and zip. And then I take my hand sanitizer. sorry, bringing that over. I take my hand sanitizer, which I have in my car, clean my hands, clean my steering wheel with some paper towels that I leave in the car, and that's really your best bet to do transact clean activity when you're in a dirty environment. Remember, the last thing that you want is to be bringing this kind of stuff into your home clean environment, getting it on your hands, touching anyone else, and then contaminating that all over your kitchen, all over your car, or your own personal body. There's a right way and a wrong way to use gloves. They can give you a false sense of security. Your hands remain clean inside, but what's happening on the surface of the glove is that it's full of contaminants and it needs to be disposed of properly. You also need to learn how to operate inside gloves. Those of us in the medical profession, that was a great deal of our training, is how to maintain clean and sterile environments from dirty environments. For those not in the medical field, this can pose a little bit of a challenge. So I hope this video is instructive to you and helpful, showing you about clean and dirty and how you need to maintain that in your world. Take good care, be clean, be safe, and stay tuned because we'll have more information coming to you.